Now, and in a leaked health department memo, there's a proposal to drop the wearing of masks and public gathering regulations. These were put in place in an effort, as we know, to curb the spread of COVID-19 in the country now more than 2 years ago. Health Minister Dr. Joe Phahla's spokesperson would not confirm the legitimacy of that document, but other officials have, but added that government had been in consultation over the current state of the pandemic and the restrictions. So, is the country ready for this kind of freedom while the pandemic is still not over? Let's speak to the president of the Southern African Society of Thrombosis and Haemostasis, Professor Barry Jacobson, joins us via our video link this morning. Prof, it's great to have you with us on the program. I mean, all of us, many of us, let's say, would perhaps welcome, for various reasons, the dropping of these regulations. But safety first, what would you do?
So it's a very interesting and complicated question, Michelle. Thank you for inviting me. I think, the question where people putting on a mask and then walking into a restaurant and taking the mask off and eating and going back outside, I mean, that does seem a bit pointless. And the science behind it is very weak. But there is some good science behind the other side. So first of all, there's a type of masks. So the majority of the masks that are being used are actually useless. We've done some research into that. So the majority of the masks are useless. You need a K95 or an N95 for it to be effective. So number one is the quality of mask that's being used that is effective. And then so what are we really doing for the public? Generalizing is very difficult. There is still an epidemic out there. We're still seeing COVID cases out there. And don't kid yourself for a moment. Long COVID is very devastating. And we have seen cases like that of colleagues even who have suffered from or suffering from long COVID. And it's really not a joke, long COVID. So the question remains, what should we be doing? For example, I know my children at school, we debated last night over the dinner table. And they would really welcome it. But there are a lot of children out there which seem to be, and my children, most of them haven't been vaccinated. So it's a complicated question. And the other thing we also have to remember is the devastating effect that it's had on the economy by stopping large gatherings, and COVID has had a major impact on causing poverty in our country. So it's not a simple yes, no, I think it's a great idea, we should stop. I think the other point that we forgot about, or that we have forgotten about in South Africa, is the massive problem we have not only of COVID, but for example, of TB. And masks will help in preventing the flow of TB, the spread of TB. You see these people coming to work in crowded taxis, and TB is rife in our country, and masks would help with that. So it's a very complicated question. I think there's to say, good idea or bad idea. What would you advise people? So I would advise my family to do would be that if you're going to a crowded area, is to wear a proper mask, an N95 in a crowded area. And, for example, you get on a plane and still remain to try and protect yourself, even if these restrictions get removed.
Yeah.
But I do understand it's a very complicated question that has got huge economic impact as well.
Certainly. It's not as simple as you or I are frustrated with wearing a mask. It's just not as simple as that. As you say, Professor Jacobson, the economic aspects of some of the regulations, that also needs to be weighed up, and I'm sure that will be done as those consultations in government take place. But, for example, in April, we saw a bit of an increase in the tourist accommodation numbers, in fact, going up to 53.4%, which was a big increase from the past 2 years of COVID-19. I mean, could we find a balance? And likely that will be how things go forward. Perhaps there won't be a blanket scrapping of the regulations, but we'll try to balance it with trying to keep up with health protocols, but also giving the economy the kind of support, giving that kind of growth the support it needs to continue.
I think that's a very valid point, and it's probably a very sort of sound and balanced way to move forward. I think, but just to get your listeners, or rather viewers, to appreciate that, proper masks are needed. If you're going to wear a mask, it should be a proper mask. And I think that's a point that people need to be aware that some of the stuff that we're putting on is nonsense.
Yeah.
So, and we did some research into that, actually looking at different masks and showing that the majority of the masks that are being used out there, we looked at for people flying, specifically in an aircraft, using just droplets to see did they go through the mask. And for the majority of those masks that people are wearing out there, they're a waste of time. You need a proper mask if you're going to have any form of effect, rather than a scarf that you're putting over your mouth or a buff. It's silly.
Yeah.
So I think that point needs to be made, to be brought across. So it's very complicated in terms of generalizations, where people just buying cheap masks, putting it on their face, and thinking they're making a difference. It doesn't really make a difference.
Yeah, absolutely. I mean, other issues like just general hygiene. We saw the flu season, for example. I think we missed a couple of flu seasons over the past 2 years of COVID-19 because there was this increased awareness of hygiene, of sanitizing your hands, of not touching various surfaces. If we can perhaps also just continue with those kinds of non-pharmaceutical interventions, that might go a long way as well.
I think so. I think it's very, very, that's very astute to notice that the flu is picking up again now, that we've noticed that people are stopping to wear masks, that flu has come back. Also, they are not vaccinating. So we have seen it. And the other point to remember in this country is that our vaccination rates are very low compared to the rest of the world. Not compared to Africa, but sadly, but compared to the rest of the world, our vaccination rates are low. But then a lot of people have been exposed in some form or other to COVID. But once again, one needs to not forget the scourge of TB that devastates this country, that we've seen a downturn as a result of wearing masks and better sanitation.
So no matter what the government regulations say, there are steps that, given what all of us now surely know about the rate of infection as so far as COVID is concerned, how to best protect yourself, the various settings in which to protect yourself if you're in a crowded room where there's limited ventilation compared to when you're outdoors. The decision will still be up to you about various regulations.
I think that's absolutely correct. We were discussing it with some of my colleagues from Cape Town, and she made the point, if you're going to go into a post office for a limited period of time, and it's a crowded area and there's not much ventilation, it's probably a good idea to wear a mask. If you're going to wear a mask at home, where you're going to not get any benefit. So if you're going to, when one exposes oneself to a high-risk situation, then it's probably it will remain a good idea for some time to come.
Yeah, and to wear a proper mask. Professor Jacobson, I want to ask you the question around, you talked about vaccination rates insofar as South Africa compared to the rest of the world is concerned. In other places around the world, the US, for example, they're also vaccinating the 5 to under 12s. For us here, it's up to 12 years. 12 to 18, that's when children can be vaccinated. Are you concerned about that group under the age of 12 insofar as vaccinations is concerned, especially given this discussion we're having around dropping certain regulations?
No, I agree. I am concerned. I think that we should be following the American system of vaccinating the children as well. I think that is a very good idea. Yeah,
particularly in schools and the levels of overcrowding in our schools. Professor Barry Jacobson, let me thank you for your time this morning. Thanks for weighing in on this discussion. Certainly one that we're keeping a close eye on. That government communique leaked on social media insofar as the dropping of various COVID-19 regulations.